You can die in your sleep. 10 quiet nocturnal habits that can lead to death after age 70. Imagine lying down to sleep like any other night and never waking up again. Sounds scary, doesn't it? The truth is that after the age of 70, some nighttime habits become dangerous and significantly increase the risk of serious health issues such as heart attacks, strokes, or even sudden death during sleep. What's worse is that most people have no idea small behaviors before bedtime might be sabotaging their health. Are you unknowingly making these mistakes? In this video, you'll discover 10 quiet nighttime habits that could put your life at risk. The last habit is the most dangerous of all, and many people do it regularly without thinking twice. Don't take that risk. Let's get started. Habit 1. Eating late at night. Eating late at night, particularly after reaching the age of 70, is a habit that can significantly compromise health and even become life-threatening. Many seniors mistakenly believe that having a snack or meal just before bedtime is harmless, but with age, the body's metabolism slows down dramatically, and its capacity to process and digest food efficiently diminishes. Eating late at night forces the body, especially the cardiovascular system, to continue working hard during a time when it should be resting and recovering. Consuming heavy, fatty meals or foods high in refined carbohydrates right before sleep leads to elevated blood sugar levels and contributes to fat accumulation in the arteries. This harmful effect raises blood pressure, disrupts heart rhythm, and can even provoke dangerous episodes of arrhythmia. Additionally, this seemingly harmless habit can lead to gastrointestinal issues such as acid reflux, which many seniors ignore or underestimate. Acid reflux, if left untreated, can escalate into severe respiratory complications, including aspiration pneumonia, a condition that is particularly deadly for older adults. Moreover, the discomfort caused by reflux can contribute to episodes of sleep apnea, a condition characterized by repeated pauses in breathing during sleep. Sleep apnea not only decreases oxygen supply to the brain but also adds significant strain to the heart, increasing the likelihood of heart attacks or strokes. Fortunately, avoiding these nighttime risks can be achieved through simple dietary adjustments. Seniors should ensure dinner is consumed at least 3 hours before bedtime, giving the body ample time to digest. Opting for lighter meals rich in protein, vegetables, and whole grains, instead of processed carbohydrates or fatty foods, can substantially reduce cardiovascular stress. Additionally, elevating the head of the bed slightly can alleviate symptoms of reflux, further enhancing sleep quality. Adopting these simple, practical changes in evening eating habits can greatly improve overall health, protect cardiovascular function, and dramatically lower the risks associated with nighttime complications. Habit 2. Drinking too much water before bed. Drinking too much water before bed may seem beneficial, especially as hydration becomes increasingly important with advancing age, yet this habit can pose serious health risks for seniors aged 70 and older. While maintaining good hydration throughout the day is essential, consuming excessive amounts of fluid right before bedtime can result in frequent nighttime urination, significantly increasing the risk of dangerous falls. The kidneys continue to filter blood through the night, but the bladder's ability to store urine diminishes with age. This means older individuals who drink large quantities of fluids close to bedtime often need multiple bathroom trips during the night. Each time an elderly person gets out of bed, particularly in a dark room and while feeling groggy, they face a heightened risk of dizziness, sudden drops in blood pressure, and potentially serious falls, often leading to fractures, hospitalizations, or worse. Additionally, excessive nighttime fluid intake can unintentionally stress the cardiovascular system. As the body attempts to manage the surplus fluid, blood pressure and heart rate may increase, placing unnecessary strain on the heart during sleep. Seniors already coping with heart issues, hypertension, or cardiovascular diseases become even more vulnerable to these harmful effects. Furthermore, constant disruptions to sleep quality due to frequent awakenings can accelerate cognitive decline. Interrupted sleep impairs memory, increases inflammation within the brain, and contributes to a higher likelihood of developing dementia or Alzheimer's disease. To minimize these risks, it is advisable for older adults to shift fluid consumption to earlier parts of the day and limit significant intake at least 2 hours before bedtime. Reducing or avoiding diuretic beverages like tea, coffee, or certain juices in the evening hours can further diminish nighttime bathroom visits. If thirsty before sleep, seniors should opt for only small sips of water, avoiding large glasses or bottles. By making these manageable adjustments, seniors can substantially improve their sleep quality, reduce the risk of nighttime falls, protect their cardiovascular health, and enhance overall well-being as they age. Habit 3. Sleeping in a hot room. Sleeping in a hot room, especially for individuals over 70, is a surprisingly dangerous habit that can have severe consequences on overall health, significantly increasing the risks of cardiovascular complications, dehydration, and even sudden death during sleep. While a warm bedroom might initially seem comfortable, excessive heat disrupts the body's natural temperature regulation, crucial for achieving restful and restorative sleep. At night, the human body naturally lowers its core temperature, enabling deeper sleep cycles vital for tissue repair, memory consolidation, and immune function. However, when the room temperature is excessively high, the body struggles to cool itself efficiently, placing unnecessary strain on the heart and cardiovascular system. This added effort can cause elevated blood pressure, irregular heartbeat, and even provoke serious cardiac events, particularly in those already living with heart conditions or hypertension. Moreover, excessive nighttime heat leads to increased sweating and fluid loss, resulting in dangerous dehydration. In older adults, dehydration significantly thickens the blood, raising the likelihood of thrombosis, strokes, and heart attacks. Additionally, excessive heat interrupts deep sleep cycles, causing repeated awakenings that the individual might not consciously notice, but which severely degrade sleep quality. Poor sleep has a cascading negative impact on health, weakening the immune system, impairing cognitive function, and exacerbating underlying medical conditions. Fortunately, seniors can significantly reduce these dangers by making straightforward adjustments to their bedroom environment. Keeping room temperature between 18 degrees Celsius and 22 degrees Celsius, 64 to 72 degrees Fahrenheit, promotes safer, deeper sleep. Using lightweight, breathable fabrics, avoiding overly heavy blankets, and utilizing fans or opening windows slightly to allow for natural ventilation can also dramatically reduce the risk of overheating. These simple changes help protect cardiovascular health, maintain appropriate hydration levels, and improve sleep quality, ultimately safeguarding older adults against the hidden but severe dangers of sleeping in an excessively warm environment. By ensuring the bedroom stays cool, seniors can improve their overall health, longevity, and well-being, making sleep truly restorative rather than a hidden nightly hazard. Habit 4. Dangerous sleeping positions. Dangerous sleeping positions are an often overlooked threat for adults aged 70 and older, as the way a person sleeps can significantly impact their cardiovascular health, breathing, and circulation. Many seniors habitually sleep on their back, unaware that this position can be particularly harmful, especially if they have existing conditions such as sleep apnea, high blood pressure, or heart problems. Sleeping on the back can cause the tongue and throat tissues to partially block the airway, leading to repeated interruptions in breathing known as obstructive sleep apnea. These pauses in breathing reduce oxygen flow to the brain, increasing the risk of stroke, heart attack, and cognitive decline. Moreover, sleeping on the back can negatively affect blood circulation, particularly in seniors with vascular issues, promoting clot formation and raising the risk of ischemic stroke. Surprisingly, sleeping on the right side, often considered safe, is also problematic. This position can compress the inferior vena cava, the large vein responsible for carrying blood back to the heart, leading to fluid retention, poor circulation, and increased strain on the heart. Instead, medical experts consistently recommend that older adults sleep on their left side, which promotes optimal blood flow, reduces pressure on the heart, and helps facilitate digestion, lowering the risk of gastric reflux. Transitioning to this safer sleeping posture can be challenging initially, but simple strategies such as placing a firm pillow between the knees to maintain proper spinal alignment, using supportive pillows behind the back to prevent rolling, or elevating the head slightly to alleviate reflux symptoms can greatly ease the adjustment. Making these small yet vital modifications can dramatically decrease the likelihood of stroke and cardiac events during sleep. By consciously adopting a safer sleeping position, seniors not only enhance their quality of sleep but also protect their cardiovascular health, reducing the risk of serious nighttime complications and contributing significantly to greater longevity and improved overall well-being. Habit 5. Getting up too quickly. Getting up too quickly, especially at night, can be a deceptively dangerous habit for adults aged 70 and older, dramatically increasing the risk of falls, fainting, and serious injuries. Many seniors may dismiss brief sensations of dizziness or vision darkening upon rising as minor inconveniences, not realizing these symptoms are actually critical warnings. Known medically as postural hypotension, this condition occurs when blood pressure suddenly drops during transitions from lying down to standing, momentarily depriving the brain of oxygen. For older adults, whose circulatory systems naturally respond more slowly, these abrupt movements are particularly hazardous, making falls far more likely. Falls among seniors are exceptionally risky, often leading to fractures, most notably hip, wrist, or even severe head injuries. A single fall can set off a devastating chain reaction, including prolonged hospital stays, reduced mobility, loss of independence, and unfortunately, an increased risk of death. Even the fear of falling again can cause older individuals to become less active, which paradoxically worsens balance and muscle strength, further increasing their vulnerability. Thankfully, avoiding this hazard requires just a few simple changes. Seniors should get into the habit of rising slowly, initially sitting on the edge of the bed and pausing briefly to allow their blood pressure to stabilize before standing fully. Keeping a glass of water at the bedside can help, as mild dehydration intensifies dizziness and hypotension. The environment itself matters greatly. Night lights or dim lighting should be installed to illuminate pathways clearly, minimizing trips or stumbles. Supportive rails or sturdy furniture near the bed also provide additional stability. Avoiding slippery surfaces, wearing non-slip slippers, and choosing clothing that doesn't restrict movement or increase slip risks further safeguard against nighttime falls. By carefully implementing these adjustments, seniors can substantially reduce their risk of serious injury from falls, maintaining greater independence, safety, and overall health as they age. Taking just a few extra moments when getting out of bed can be life-saving, enhancing quality of life in later years. Habit 6. Ignoring sleep apnea and insomnia. Ignoring sleep apnea and insomnia is a serious mistake that can profoundly jeopardize the health and longevity of adults aged 70 and older. Many seniors dismiss snoring or occasional nighttime awakenings as normal aging processes, unaware that these symptoms may indicate dangerous underlying conditions like obstructive sleep apnea or chronic insomnia. Sleep apnea occurs when airway tissues relax excessively during sleep, causing repeated pauses in breathing, often without the person realizing it. Each breathing pause drastically reduces oxygen levels in the blood, forcing the heart to work much harder. Over time, untreated sleep apnea significantly raises the risks of high blood pressure, stroke, heart attack, and even sudden death. In addition, sleep apnea prevents deep, restorative sleep, resulting in daytime fatigue, impaired memory, and reduced cognitive function, factors directly associated with increased risks of dementia and Alzheimer's disease. Insomnia, on the other hand, can also signal hidden health issues such as cardiovascular disease, hormonal imbalances, neurological disorders, or chronic stress. Frequent inability to fall asleep or frequent nighttime awakenings deprive the body of essential rest, weakening the immune system, exacerbating hypertension, and increasing susceptibility to diabetes and other chronic conditions. Seniors experiencing regular insomnia or symptoms of sleep apnea, including loud snoring, choking sensations during sleep, morning headaches, or daytime sleepiness, should seek medical evaluation immediately. Simple lifestyle changes can help mitigate these risks significantly, sleeping on one side instead of the back, maintaining a healthy weight, and avoiding alcohol or sedatives before bed, which relax throat muscles and exacerbate apnea. Creating an ideal sleep environment, dark, quiet, and cool, also greatly enhances sleep quality. In cases of diagnosed sleep apnea, using medical equipment like a CPAP machine can dramatically improve breathing and reduce associated health risks. Addressing these sleep disorders promptly and proactively can profoundly improve quality of life, boost cardiovascular and cognitive health, and potentially add many healthier years. Ignoring the body's nighttime distress signals is not just uncomfortable, it's dangerously detrimental, reinforcing the importance of timely action and proper care for seniors. Habit 7. Drink alcohol or smoke before bed. Drinking alcohol or smoking before bed may initially appear relaxing, but both habits carry significant health dangers, particularly for adults aged 70 and older. Alcohol, commonly perceived as a sleep aid due to its sedative effect, actually disrupts restful sleep by excessively relaxing throat muscles, dramatically increasing the risk of obstructive sleep apnea. In seniors, sleep apnea is especially dangerous as it repeatedly interrupts breathing throughout the night, reducing blood oxygen levels and forcing the heart to work harder. Over time, untreated sleep apnea greatly heightens the risk of high blood pressure, stroke, heart attack, and even sudden death. Smoking before bedtime poses equally serious risks, as tobacco smoke irritates and inflames the delicate airways, making breathing difficult and causing frequent nighttime awakenings. Nicotine, a stimulant, elevates heart rate and blood pressure, placing unnecessary strain on the heart precisely when it should be resting. The combined cardiovascular stress and airway irritation resulting from nighttime smoking significantly increase seniors' vulnerability to stroke, heart attack, and chronic respiratory illnesses like COPD. Moreover, disrupted sleep caused by these substances weakens immune function, impairs cognitive abilities, and exacerbates existing health problems. To mitigate these severe health hazards, seniors should commit to avoiding alcohol and tobacco entirely in the hours before bedtime, ideally at least 3 to 4 hours prior to sleep. Choosing healthier evening rituals such as gentle relaxation exercises, reading, or sipping calming herbal teas can effectively replace these harmful habits. Creating a smoke-free and alcohol-free pre-bed routine greatly reduces sleep disruptions, supports clearer breathing, decreases heart strain, and significantly lowers the risks of severe cardiovascular and respiratory events. By proactively eliminating alcohol and smoking from their nighttime routines, older adults can vastly improve their sleep quality, safeguard their health, and enhance overall longevity, leading to safer, more restful nights and significantly healthier years ahead. Habit 8. Medication before bedtime. Taking medication before bedtime might seem routine or harmless, especially for adults over 70 who often rely on nightly medications such as sleeping pills, blood pressure drugs, muscle relaxants, or painkillers. However, this seemingly benign habit can pose serious and sometimes deadly risks during sleep. Sedatives and sleeping pills, including benzodiazepines such as diazepam or alprazolam, while commonly prescribed for anxiety or insomnia, can dangerously slow breathing and impair cognitive function in seniors. This increases risks significantly, especially for older adults with existing respiratory issues or heart conditions, potentially leading to respiratory arrest or fatal complications. Additionally, these medications often cause lingering drowsiness and confusion upon waking, greatly increasing the likelihood of falls, fractures, and other injuries. Blood pressure medications taken before bed also present hidden risks. Though beneficial for many seniors, they can sometimes cause dangerous drops in blood pressure during sleep, severely reducing blood flow to the brain and heightening the risk of strokes. Even common painkillers or anti-inflammatory drugs like ibuprofen, routinely used for joint or muscle pain, can silently damage the kidneys and liver over time when taken regularly before bedtime. Furthermore, they can interfere with blood clotting mechanisms, increasing vulnerability to internal bleeding or even hemorrhagic stroke. To minimize these risks, seniors should consult closely with their healthcare providers to ensure that nighttime medication use is truly necessary and safe. It's vital never to alter or discontinue medications without professional guidance, but seniors should ask their doctors about safer or alternative options if possible. Natural relaxation techniques or herbal teas might sometimes replace sedatives. Regular monitoring of nighttime blood pressure can prevent sudden, dangerous drops. Being aware of potential drug interactions is also crucial, as combining medications could amplify adverse effects. By proactively managing nighttime medication routines and communicating openly with medical professionals, seniors can avoid unintended health crises, improving not only their safety during sleep but significantly enhancing their overall well-being and longevity. Careful medication management ensures restful sleep without hidden dangers. Life after 70 comes with unique joys, but also requires careful attention to habits we often take for granted. Small, unnoticed choices made nightly can quietly shape our health, longevity, and overall well-being. Eating heavy meals late, drinking excessive water before bed, or sleeping in rooms that are too warm may seem harmless, yet these simple acts can silently weaken our hearts, disrupt restful sleep, and compromise cognitive health. Similarly, the positions we sleep in, the haste with which we rise from bed, and even the medications we casually take before sleep carry hidden risks. Ignoring subtle warnings like snoring or persistent insomnia can lead to serious health issues that may profoundly diminish quality of life. The deeper lesson here is that true self-care means paying mindful attention to seemingly minor routines, recognizing that our bodies become more sensitive with age, deserving thoughtful consideration and gentle care. Choosing healthier nighttime routines, eating lighter dinners earlier, creating comfortable sleeping environments, managing medications wisely, and consciously avoiding harmful substances can dramatically enhance physical and mental resilience. Ultimately, aging gracefully is not about surrendering to limitations, but rather embracing thoughtful habits that protect our health, maintain independence, and enrich our golden years. By valuing restful, safe sleep as a cornerstone of vitality, we empower ourselves to live not only longer but more meaningful and joyful lives. Thank you for following us till the end. Don't forget to show some love by clicking the like button and subscribe. This supports the channel and allows me to continue creating content for you. Leave your thoughts or comments below. Feel free to express yourself and stay positive. See you next time.